Dr. Spero, thank you so much for joining me for another Q&A to talk about testing, the coronavirus, and the future of the pandemic and what we can expect.
Happy to be with you again, Thomas.
Excellent, thank you. So my first question that, this comes up often is, what is the difference between antigen and molecular diagnostic testing?
Yeah, absolutely. So it's a big divide between antigen testing and molecular testing. Antigen testing is just directly testing particles or proteins that are on the virus, where molecular testing is actually amplifying the RNA, the genetic material, nucleic acids, which are part of the virus, and amplifying it up to like 1,000 times, so it can be much more sensitive at identifying the virus. So there's a big difference in the two, because one is much more sensitive. Molecular testing is much more sensitive than antigen testing. And in addition to RT-PCR, which is something that's typically done in the lab, the Abbott ID Now units that are out there also do nucleic acid amplification. They do it in a slightly different process. It's isothermic versus variable temperatures. But it's also a nucleic acid amplification. And so that's why the Abbott ID Now is such a great solution as well, compared to the antigen testing.
I guess that leads to a follow-up question. What's better as of right now, in September of 2020, what's better, antigen testing or the molecular Abbott testing, the PCR?
Absolutely, hands down, molecular testing is a superior product. Yeah.
And why is there such a cost disparity between COVID testing solutions?
It has to do with several things. Because there's so many players in the area, people are willing to do it at lower margins than other people. Some people are doing a lot higher to make more money. But also you have a variability in the quality of the test. So as we talked about, antigen testing is an inferior product to molecular diagnostic testing for COVID. So it's being sold at a much lower price point than PCR or Abbott testing. But it's a combination of different profit margins, and then also the quality of the test.
Is it safe to say that if you're using antigen testing, you're not really protecting your population?
I wouldn't go that far. I mean, antigen testing is much better than doing nothing. I think the only concern with antigen testing is that it's a false sense of security, because the sensitivities are lower, that you may be getting negative results, but they may be false negative results. Now, it's not saying that you can't get false negative results with PCR or Abbott ID Now units, both which are molecular testing, but the antigen testings, you're going to have much more false negatives. So you could test the whole population, asymptomatic population, and think everybody's good, but you're missing more than you would with molecular testing. So if you're going to do antigen testing, because you have more false negatives, it would be advisable to do it much more frequently, because you want to make sure if you miss somebody that you catch them the next time. A lot of people are just not doing surveillance testing, so they'll do testing and then they just won't repeat it, but they're going to miss more positives than they would with molecular testing.
And IHP is doing lots of testing at major higher education institutions. What have you seen so far?
I've seen most of the folks that we're working with in the university setting are either using RT-PCR testing, where we send it out to the lab, or they're using the Abbott ID Now rapid test machines. I'm not seeing a ton of antigen testing with the large populations. I'm starting to see a lot of the antigen testing and the rapid antigen testing and the rapid ID Now testing in the athletic departments of universities. So because they need the results quickly. And people are choosing the antigen testing a lot now because in that scenario, because first of all, it's available. The Abbott ID Now units are hard to come by. That's why in-house physicians is very fortunate in a good situation, because we have a whole fleet of over 100 Abbott ID Now units. So these athletic departments are being kind of forced to use, if they want a rapid test, they're being forced to use the antigen testing, because the Abbott ID Now is not as readily available, and it's not quite as inexpensive as the antigen testing.
Dr. Spero, thank you so much for this Q&A. I really appreciate it. It was super insightful as always.
Yeah, I appreciate being on your show again. Thank you.